What we're going to look at right now is the overhead squat assessment. So in order to set up the assessment, we want to make sure that our client is in optimal alignment. So we want feet nice and straight ahead, basically parallel like they're on railroad tracks. We also want the toes lined up with the ASIS joint, or basically the hip. From there, we want the knees pointing with the second and third toe. We want the hips in a neutral position as well. In order to set up the hips in a neutral position, what we're going to ask the client to do is go ahead and arch the lower back, or that anterior pelvic tilt position, then do a posterior pelvic tilt position right in between now. Perfect. Ask them to draw the navel in, and then we're going to bring the arms above the head. It's really important when we do this particular assessment that the shoes are off, so that way we can kind of see what's going on with the foot and the ankle, as well as make sure that maybe they have shorts on, or we roll the pants up past the knees, so that way we can kind of see what's going on with the knees during the assessment. All right, when you go ahead and have a seat, we're going to do about at least maybe 5 to 10 squats here. As we're doing the squats, like as a trainer, I can post up here in the anterior view, and I can basically look for 2 compensations. One's going to be the feet turn out compensation. So Wendy, go ahead and demonstrate what the feet turn out compensation might look like. So they're in neutral, but then as she starts squatting, they start kind of rolling to the outside there. Perfect. Go ahead and bring your feet back to neutral again. And then we can also see the knee cave-in compensation. So the knee cave-in compensation is when you start seeing the knees migrate towards the big toe. Remember, the knee should be pointing towards the second and third toe. Perfect. Or we might see both at the same time. So go ahead and turn the feet out. If you look how the feet are turned out, and if you look at where the knee is going, it's going straight ahead. But even though it's going straight relative to the toe, it's actually a knee cave-in compensation. So we're actually seeing both here. All right, so with the overhead squat assessment now, we're going to look at the front view. We're going to look for 2 compensations, whether or not the feet turn out or the knees cave in. So go ahead and have a squat there, Wendy. Perfect. Go ahead and do a couple more. So pretty clean for the most part. Typically with the feet turn out compensation, this is what it might look like. You'll see the ankle pronate in and the feet turn out. Perfect. That's exactly what it looks like for the most part when you see it with a lot of your clients or athletes. Excellent. You can also see the knee cave-in compensation, where you'll see the knee migrate towards the big toe. Perfect. And then we can also see both at the same time, where the feet are turning out and the knees are caving in. Typically, as the feet turn out, and if you look where the knee is pointing straight ahead, but relative to the toe, it's actually in. So we can call that a knee cave-in compensation. Now we can actually look at the side. So from the side view, same alignment, hands above the head. We're going to look for 3 different compensations. Go ahead and have a seat. Perfect. The first compensation we can look for is an excessive forward lean. That's where the trunk is falling forward too much. And as a trainer, what we can look for is parallel lines between the shin and the torso. So shin, torso, do we match up with parallel lines here and back up? If she leans forward, go ahead and lean forward some. Now she's more bowing than she is squatting, and that can tell us that she has an excessive forward lean and tightness in certain areas. Perfect. Now the next thing we might see is a lower back arch. Perfect. So as she squats, there's an excessive arch through the lumbar spine. Or we can also see the arm fall forward compensation. And typically when you see the arm fall forward compensation, that's where you might even see their ears as they squat, as the arm should stay at about 180 degrees of shoulder flexion. Perfect. And that's our overhead squat assessment. With the overhead squat assessment, there are many modified versions that you can do. One such modified version of the overhead squat is going to be with the heels elevated. So we can use a wood plank 2x4. We have 2 10-pound plates here that we're going to have Wendy's heels on. And by elevating the heels, that's going to allow for more range of motion at the ankle. And if her squat cleans up, if it gets a little better with this, then that really tells us that her ankle may be the limiting factor in terms of her flexibility and her movement compensations. So go ahead, same position. We can do, let's go arms above the head. And then we have her squat. Still looking for the same compensations where the feet turn out, knees cave in. From the side, we're still looking for the excessive forward lean, the low back arch, as well as the arms fall forward. Really what we're looking at is whether or not does she have greater range of motion here, does she have a cleaner squat. Perfect. Let's go ahead and take a look at the side view real quick. And if you look at the previous video, she's going a little bit lower now with her squat, and her squat's a little bit cleaner. So that can tell us that maybe her ankle dorsiflexion, she's limited in that. That may be tightness to the calves complex. Perfect.